So if you look at a word and, you know, while you're taking the exam and you're not too sure what the entire word means, if you just know a piece of the word, that might just be what helps you to get that question correct on the exam. Hey guys, welcome back to another video. My name is Alexis if you're new, and if you're returning, welcome back. In this video, we will be covering study tips and material that you need to know for the exam, the medical assistant exam. This video was actually another highly requested video, so I'm so glad that I'm finally able to get this video out, and I'm so sorry for the wait. I just been having a lot going on and just like trying to live life, and I don't know. So thank you guys so much for your patience. So in this video in particular, we'll be covering medical terminology. I didn't want to overwhelm you guys, so I'll be covering different topics in a series of videos so that you can refer to them and study at your own pace. So the topics that will be covered will be medical terminology, medications to know in pharmacology, diagnostic and treatment terms, general target ranges for medical conditions, body systems and organs, medical procedures and instruments. And yeah, I'm just gonna focus on what I remember being key information when I was in class, stuff that my professor kind of stressed and stuff that she recommended we pay more attention to. Okay, and before I get into the video, I do wanna go over some study tips. First study tip I have for you guys is to take lots of practice exams. I can't stress this enough. Familiarizing yourself with how the exam may be set up and familiarizing yourself with like how to prepare yourself for the exam, if that makes sense. Just getting used to the wording of questions and what type of questions it may be asking, and just trying to figure out what areas that you may need to improve on and what areas that you are doing really good in. The next tip is to learn your terminology. I'm going to be going over medical terminology in this video, but I'm not going over like everything. I'm just going over key things, key terms that I know my professor stressed in my class. But I still want you to familiarize yourself with as much terminology as you can, just in case you might see it. You never know. You know, I can't tell you what's going to be on your exam, so just in case you do want to familiarize yourself with as much terminology as you can, but definitely memorize the ones that I'm going to be going over today. The next tip is to use flashcards. I mentioned this in my medical assistant Q&A video. The reason I recommend flashcards so much is because not only does it work on your short-term memory, but it also works on your long-term memory. Yeah, you'll be like studying and you'll be like, you know, going through it over and over again, and you'll be like, okay, yeah, I remember. But then like next week, when you pick those same flashcards back up, you will realize, you'll realize that I finally know it by heart. That's when you know that you are utilizing now your long-term memory. The next tip is to make sure you're creating a study schedule and setting time aside for that. I'm gonna put it on the screen if I can find it, but I remember reading something a while ago that said something about studying around the same time every day helps you to memorize the material better or something. But if I can find it, I'll put it in the video. But if you can study around the same time every day, then that's very helpful. If not, it's not a big deal, but just make sure you are setting time aside to study for the exam. Even if it's just an hour, at least an hour, like to study, and make sure you're understanding what you're studying, and make sure you're giving the material undivided attention. You're not like on your phone. Like I mentioned in the Q&A video, I had to set a timer. Like it's something I've been doing recently, you know, because I'm still in school for something else, but I set timers during my study time. I'll set like a 30-minute study timer for me to hone in on my material for 30 minutes, and then I'll set like another 30-minute timer for me to take a break, or 15-minute timer for me to take a break, or whatever works for you. But just make sure if you're gonna set aside 2 hours to study, you're actually like focused for those 2 hours. It's actually gonna go into the next study tip. Take breaks. Definitely don't just like try to like sit through whole 2 hours studying, because you're not gonna absorb as much material as you think. Make sure you're getting plenty of sleep. Make sure you're giving your brain time to recover and absorb the information and understand the information. Make sure you definitely get enough sleep before the exam. You don't want to be staying up for hours studying. Definitely don't procrastinate. Don't, you know, put it off until the day before the exam or the night before the exam. Make sure you're studying material throughout the course and understanding each chapter that you're going through, and doing your due diligence to figure out the areas that you can improve in, so that you can make sure you give more attention to that area. And yeah, make sure you're getting sleep, make sure you're getting rest, give your brain some time to recover. And the last tip I have for you guys, I highly recommend a planner, you guys, and not just because I'm selling it, not just because I'm selling it, but because it really helps me to stay organized. You can't really expect yourself to hold all your information, everything that you have to do, all your priorities, just all that stuff in your brain, even in your phone. I just know that when I use my planner, I am so much more organized. I am so much less stressed out. Just like putting that pen to paper, just like being able to look at it on paper. Like for example, in this planner, for example, in my current planner, I have it color coded because it really helps me to like, it helps certain things to stand out to me. So for example, the orange is for bills. The green is for paydays. The yellow is for like things that I have to do, like my class schedule, work, stuff like that. And then the pink is just like stuff for me, like my personal stuff, like therapy, my nail appointment that I have today, like it's stuff like that. Another thing in this planner that I added, just because when I was in school, I was also working full-time, is an income tracker and a budget, a monthly budget tracker, I guess is what you can call it. I've been doing this for a while. I just never had like an actual planner that had this tracker in it. So I decided to create a planner with a tracker in it to help those who are not just students, but also working. And like I said, like just putting the pen to paper, writing it out, getting it from here to here makes all the difference. All right, so now we're gonna get into medical terminology. Before I get into terms and stuff like that, I definitely want to break down medical terminology just a little bit. And just to let you guys know, I did refer to my medical terminology for dummies book. I might do a giveaway and give this away to somebody, to one of you guys on the channel, once I get done using it for all the study videos that I'm gonna make. But this book is like an all-in-one. So when it comes to medical terminology, there's different parts of the word. For example, the root part of the word is the main part of the word. The prefix is the beginning part of the word. And the suffix is the ending of the word. So when you hear me say root, prefix, and suffix, I just want you to know what I'm referring to. Another reason why learning different parts of the word is important, because it's really helpful when you're struggling to remember what the entire word means. So if you look at a word and while you're taking the exam and you're not too sure what the entire word means, if you just know a piece of the word, that might just be what helps you to get that question correct on the exam, just because you knew what part of the word meant and you were able to connect A and B together. For example, you might get a question that says, which of the following medical terms refers to the removal of a kidney? And your answer choices may be A, nephrectomy, B, nephrolithotomy, C, nephritis, or D, nephrostomy. If you studied your medical terminology, then you know to immediately cross out answer C, because itis means inflammation, and nowhere in the question is it asking about inflammation. And you should already know that nephro, the beginning or the prefix of each of those words, is referring to the kidneys, because they all are saying nephro. So if you had saw something like something random in there that didn't go with the rest of the answer choices, like for example, if you would have saw the word like hepatitis, like meaning which is the inflammation of the liver, then you would know like, okay, like the rest of these are saying nephro, or starting with the prefix nephro, but this one is starting with hepat. So one of these is not right, and it's not the ones that all are alike. It's got to be the one that's standing out. So if ectomy means cutting out or the surgical removal of, and otomy means the process of incision or cutting into, and stomy means the artificial surgical opening of something, which answer do you think it is? All right, well, if you said nephrectomy, then you were correct. That is the removal of. Again, chances are you won't remember every suffix, every prefix, every root word, but anyway, it's still important to familiarize yourself with all the terms and stuff that you can, so that you aren't surprised. You don't run into any surprises when you're on the exam. Now let's get into prefixes to know. Ambi or ambo means both. Anti refers to before, in front of, or forward. Anti refers to opposing or against. Auto refers to self or by yourself. Brady refers to slow. Circum refers to around. Contra again means against or opposed to. Dia refers to through, apart, across, or between. Dis refers to apart from or free of. Dys, D-Y-S, refers to bad, painful, or difficult. Ect, exo, or ecto refers to outside, outer, or on. Endo, ento, means within or inner. Epi is upon, over, or on. EU, or you, means normal. Extra or extro means beyond, outside of, or outward. Hyper means excessive, above, or beyond. Hypo means below, beneath, or deficient. Inter refers to between. Intra refers to within or inside. Intro refers to into or within. Macro means large. Mal means bad, like in French. Micro means tiny or small. Nuo means new. Poly means many. Post means after or following. Pre means before or preceding. Super or supra means above, excessive, or superior. And tachy means fast. Examples of some of these would be bradycardia, which means slow heart rate. So Brady means slow, that's the prefix. So bradycardia means slow heart rate. Hypertension means high blood pressure. Hypotension means low blood pressure. Polydipsia means excessive thirst. Polyuria means excessive urination. Tachycardia means fast heartbeat. Moving on to root words to remember. Abdomen means abdomen. Adeno means gland. Andro means male. Anterior means artery. Arthro is referring to the joint. Audio is referring to hearing. Blepharo is referring to the eyelids. Brachio is referring to the arm. Cardio is referring to the heart. Cephalo referring to the head. Cholecysto is referring to the gallbladder. Colo is referring to the colon. Colpo is referring to the vagina. Cryo means cold. Cutaneo referring to the skin. Cyano means blue. Dermato or dermo is referring to the skin. Encephalo, the brain. Erythro means red. Gastro is referring to the stomach. Gloss means tongue. Gyneco is referring to female. Hepato or hepatico, referring to the liver. Hetero means other or different. Homo or homeo means same or alike. Leuco, referring to the word white. Mammo or masto is referring to the breast. Melano, referring to black. Myo, referring to the muscle. Rhino, referring to the nose. Sarco is referring to flesh. It's gonna help to remember these because it's gonna help you to remember like different medical conditions and the different body systems because it's all like connected like that. All right, so it's time to get into suffixes to know. And suffixes again means the ending of the word. So starting with ak, ik, ow, or us, or tick is related to or pertaining to. Algia, dynia is referring to pain or discomfort. Sight is referring to cell. Ectomy again is the cutting out or surgical removal of. Emia is pertaining to blood or a blood condition. Esis, ia, iasis, idiosis is a state or condition of. Itis means inflammation. Lysis is the destruction, breakdown, or separation of. Megaly is enlargement. Anything ending in the word meter means instrument used to measure. Anything ending in the word ologist means one who studies or a specialist. Oma, anything ending in the word oma is referring to a tumor, neoplasm, or a swelling. Otomy is the incision or cutting into of something. Pathy is a disease or abnormality. Penia is the lack of or is a deficiency. Phobia means fear. Plasty means surgical reconstruction or shaping of. Penia is referring to breathing. Rage or ragia is the excessive flow or discharge of something. Ria is the flow or discharge. Anything ending in the word scope is an instrument used to visually examine something. Anything ending in the word scopy is a process of visual examination. So we're getting close to the ending of the video. Congrats to you for making it this far. You made it this far already. So some tips that I pulled out of the Medical Terminology for Dummies book is this. I'm gonna read from what I pulled out of it. The prefix and suffix are adjectives in a way, telling you something about the root word in the middle. Changing the prefix or the suffix changes the entire meaning of the word or the term. Remember that the suffix always has the same meaning, no matter what root word is tacked onto. The suffix is the first place to look when trying to analyze or break down a medical term. So you'll look at the suffix first, then the prefix, and then finally the root of the word. The root word describes the body parts involved in medical term and can help a lot to remember when it comes to remembering the meaning of a whole word. Examples, we already talked about arthro means joint, colo means colon, laryngo means larynx, myelo means bone marrow, myo means muscle, neuro means nerve, osteo means bone. So the suffix indicates a procedure, disease, disorder, or condition. For example, the suffix itis is pretty common, as we discussed. It means inflammation. So every time you see the suffix itis, you know it means something is inflamed. So when you take the word tonsil and add itis at the end, which gives you tonsillitis, you know it means inflammation of the tonsils. All right, guys, so that concludes this video. I really do hope that I was able to cover this material in a way that was easy for you to understand. I really hope you guys made the flashcards along with this video for you to familiarize yourself with prefixes, suffixes, and root words. And yeah, that's it for this video. The next video will most likely cover medical conditions to know. Not absolutely sure yet, but that's what I'm currently leaning towards. So stay on the lookout for the next video. I'm hoping to get it out not too long after this video goes up. And yeah, I appreciate you guys for watching. I hope you gained something from it, and I will catch you guys all in the next video.